Okay, so hi, I'm Lori Quinn from Biobehavioral Sciences. It's really great to be here. So I'm going to talk about one bit of work that I am doing on addressing racial disparities in engagement of ethnic minorities with Parkinson's disease specialists in Washington Heights and Inwood. So we have a multidisciplinary group of researchers that we've been working with to try to address problems in healthcare disparity. We know that people with Parkinson's disease actually get diagnosed much later. People who are Black with Parkinson's disease get diagnosed much later than individuals who are white. There's actually people who believe that there's actually a decreased incidence in the Black population, but in fact, that's really not true. We think a lot of this just stems from the fact that there's this decrease in access to care, and we wanted to try to understand why that was. So we partnered with a faith-based organization and with Dr. Hiral Shah, who's out of Columbia University, to try to build trust within the community. We developed a partnership with some faith-based organizations. I think a big part of this was developing empowering culturally sensitive messaging and working together very collaboratively with this group. So not us as being the white coats coming in and talking and telling this is what you need, but really asking the questions, sitting and working together where all members of the table are really valued. These are just a list of a few of the research activities that we've done, and I just want to highlight a few. Along with my students, we conducted a really comprehensive literature review on this topic, which led to conducting 2 focus groups that we're currently analyzing the data right now in collaboration with members of the Black community. So it's a really collaborative process. We are working on publishing papers. Part of what we do within the community is doing community health fairs, which is something that our community members have asked for. So we very much focus that on brain health and prevention of neurodegenerative diseases. And we developed a storybook, which I will show you in a second. What we found from these, from the focus groups and from the literature review was that it's a very complex problem understanding health disparities. And these are all the possible factors at the system, provider, community, and individual level that contribute to this really complex problem. But what we do know is that there are disparities, and this results in increased disease severity for people in the Black and African American community. So this just shows some of the pictures from the health fair that we conducted. We have 2 coming up in May. We're very much looking for people to collaborate on these and to join at tables. We have cognitive screenings, we have balance and falls screenings, a whole bunch of things. And this is a copy of the PD Movers book, which is freely available. This book, yes, tells wonderful stories using a storytelling approach of individuals who are Black or African American and how they're living and thriving with Parkinson's disease. And it also highlights some myths about Parkinson's disease that can be shared so that people can use this starting a conversation about Parkinson's disease. And these are our collaborators. Thank you very much.